Right, and again, good afternoon, greeting will count for my gavel to begin. Um, for the record, my name is Tanya Fernandes Anderson, the District 7 City Councilor. I'm the chair of Boston City Council Committee on Ways and Means. This hearing is being recorded. It is being live streamed at boston.gov/city-council-TV and broadcast on Xfinity Channel 8, RCN Channel 82, and Files Channel 964. The council's budget review process will encompass a series of public hearings beginning in April and running through June. We strongly encourage residents to take a moment to engage in this process, and by giving testimony for the record. You can do this in several ways. One, by attending one of our hearings and give public testimony. We will take public testimony at the end of each departmental hearing. Rather, I keep reading that, but instead, in this hearing, just to respect the constituents' time, we'll take public testimony in between round 1 and round 2. And also at 3 hearings dedicated to public testimony. The full hearing schedule is on our website, boston.gov/council-budget. Our scheduled hearings dedicated to public testimony are Tuesday, May 2nd at 2 p.m., Tuesday, May 9th at 6 p.m., Thursday, May 18th at 2 p.m. For virtual testimony, you can sign up using our online form on our council budget review website or by emailing the committee at ccc.wm@boston.gov. When you are called to testify, please state your name, affiliation, and/or residence, and limit your comments to a few minutes to ensure just literally 2 to 3 minutes to ensure that all comments and concerns can be heard. Email your written testimony to the committee at ccc.wm@boston.gov or submit a 2-minute video of your testimony through the form on our website. For more information on the City Council budget process and how to testify, please visit the City Council's budget website at boston.gov/council-budget. Today's hearing is on dockets 0764 to 0762, orders for the FY24 operating budget, including annual appropriations for departmental operations for the school department and for other post-employment benefits, OPEB. Dockets 0763, 0765 to 0766, orders for capital fund transfer appropriations. Docket 0764, 0767 to 0768, orders for the capital budget, including loan orders and lease purchase agreements. The focus of this hearing is the fiscal year 24 budget for the Boston Public Health Commission. This hearing will cover mental health and recovery. Our panelists for today's hearing are Tim Harrington, Director of Administration and Finance, Boston Public Health Commission, Dr. Bisola Jakutu, as Executive Director of Boston Public Health Commission. I am joined by my council colleagues by order of arrival: Council President Ed Flynn, District 2, Councilor Aaron Murphy at large, Councilor Michael Flaherty at large. For the format, once again, I will go to, sorry, someone's hands are raised. Oh, sorry. Back to my screen. Also joined, we are joined here by Councilor Ricardo Arroyo, District 5. Is that everyone? Okay, thank you. For our format, we will, once again, I will allow my council colleagues 30 seconds for any opening statements, and then on to our first round of questions, 5 minutes each. I will set a timer. You will hear a ring tone go off, and once it goes off, I'm asking for the courtesy to stop your questions and wait for a second round. I'm happy to do a second and a third round if time permits. And then with more flexibility at our last round, to allow just for open comments or back and forth conversation. But I would like to stay tight to the schedule, and please stop at 5 minutes once you hear the timer. You'll hear me say thank you once the administration has answered the question, and pretty much means we need to move on to the next person. All right, without further ado, again, by the order of arrival, Councilor President Flynn, you have the floor for an opening statement.
Thank you, Madam Chair. Madam Chair, can you hear me?
Yes, I can, President Flynn.
Okay, thank you. Thank you to Dr. Ojukuchu and to Tim. Thank you for the important work their team is doing on public health issues. I had a good opportunity to talk to both of them this morning, so I have no opening statement at this time. Thank you, Madam Chair.
Thank you, Council President Flynn. Councilor Murphy, you have the floor.
Hi, thank you. Thank you again, Dr. Ojukuchu and Tim, for coming back for the afternoon session. Looking forward to the content that is going to be like a closer look at this afternoon. Looking forward to the conversation. Thank you.
Thank you, Councilor Murphy. Councilor Flaherty.
It's just a brief opening because I got bumped off and I just had to come back on, Madam Chair.
Yes, sir. Brief opening.
On recovery.
Yes.
Yeah, just so obviously, thank you for the opportunity, and just things that I'm going to be looking for is around sort of recovery services, and particularly under the guise of the harm reduction. Just want to know how much we've been spending on, the passing out of needles and particularly those kits, and then more importantly, in the event of an overdose, and under the guise also of harm reduction, why aren't we transporting those individuals to either the emergency room and or to somewhere so they can get treatment and recovery? And the sad part is a lot of times when someone overdoses, their family members don't even know because they get Narcan. I happen to think anytime we administer Narcan, that deserves a trip to the hospital. But when we administer Narcan, more often than not, the person just jumps up and walks away, and we really don't do anything about it. We can't ask them to, or we can't take them, I guess, to the hospital. So I'd like some answers around, again, under the guise of harm reduction. If we're going to be passing out needles, we should be transporting folks to the hospital when they overdose. But thank you, Madam Chair.
Thank you, Councilor Flaherty. Councilor Arroyo, you have the floor.
Thank you, Mrs. Chair. I appreciate the work that the Boston Public Health Commission does. My focus is really on the trauma response and making sure that we are properly staffing and sort of have a budget that incorporates the work that they should be doing, that they're currently doing, but also to sort of see how we can push that budget or that aspect of the budget to maybe make it so that there are more roles that they're able to take on and more sort of capacity that they have for these kinds of situations. And so I'd love to sort of have my questions be focused around the trauma response team, the work that they do, how we're funding that currently, and how we can possibly grow that more. And so I'll have conversations related to that. So thank you to the folks from the Boston Public Health Commission for being here, and I look forward to hearing from you and asking those questions. So thank you, Madam Chair.
Thank you, Councilor Arroyo. Councilor Mejia and Councilor Lujan would like to extend their apologies for not being able to be here with us this afternoon. I do have some questions that Councilor Lujan has submitted to the committee, and happy to read them in the end. I did want to quickly, apologies, I'm just pulling this up, acknowledge and welcome our youth advocates who are in the Piemonte room today, who rushed out of school, got coordinated or left school early to be here today. Megan, I'm sorry, I'm trying to find that list now. I think you had sent it over. Oh, here you go. Got it, okay. Thank you so much. I wanted to welcome Malette, Don Belkin-Martins, Ren Pillinger, Whitney Golden, Emmy Tekinami, Daniel Mudia, Hussein Rizvi, Armelo, Howie, Mel Fan, Yan Huyen, and please correct me when you come on the mic, Zakiel Smalls, Joaquin Atala, Devin Atala, Don Belkin-Martins, Amutala Mervin, Ariana Brown, Charming Solomon, Chloe Frankel, Christian Mariano, Ella Simone James, Fiona Fee, Hamdi Aden, India Giri, Joaquim Alombos, Kyra Nunez, Halil Howie, Maya Milik, Sashi James, Shania Bailey, Vedeline Verdieu, Vina Ngo, Isiana Davis, Janaya Lee, Chloe I'm gonna need help with that, Megan. Do you see this? Do you see where I am, Megan?
Yes.
So Chloe, welcome. Olivia Nichols, we're gonna get all kinds of corrections after this. I appreciate your grace bearing with me, guys. Olivia Nichols, Alice, George Lee, Naria Beckton, Tia Simon, Amanda Lawson, Betiel Brain, Caroline Nunez, Marina Brain, Tara Venkatraman, Ziandria Nunez Pina, Teresa Tran, Roy James Daly, Jasmine Permo. All right. Welcome, everyone. I wanted so desperately to be there with you in the Piemonte room, and my fire alarm is going off all day, and I need to be here because the departments have already visited me a couple times, so I apologize I couldn't leave my home. All right, Dr. Jukutu and Tim, I will now give you the floor. I do see on my screen that Councilor Worrell and Councilor Lara has joined us. Welcome, Councilor. I am sorry if I don't have the order of arrival correctly, but Councilor Worrell, please, if you have a 30-second introduction, the floor is yours. And Councilor Lara, if you'd like to give an opening statement as well for 30 seconds.
I'll save my remarks for my line of questioning. Thank you, Chair.
Got it. Thank you. Councilor Lara?
Thank you, Madam Chair, and thank you to everybody from the Boston Public Health Commission who's here today, and to all of the folks who are across the hall here at the Monty Room visiting to give testimony and to watch this hearing. As somebody who is a former employee of the Boston Public Health Commission and started a lot of my professional career doing public health work, I'm continue to be incredibly impressed by the work that you do at the Boston Public Health Commission. And I know how important the work that you do there is for the city of Boston. So I am excited to take a closer look at your budget and see how the financial resources that were invested are in alignment with the mission and the vision that you've set forth for the city. Thank you, Madam Chair.
Thank you, Councilor. Dr. Jukutu and Mr. Harrington, you have the floor.
Thank you, Chairperson Anderson. Good afternoon, City Councilors, and good afternoon to the young folks who are participating in this hearing. Thank you for giving us this opportunity for us to testify this afternoon in this second session. My name is Dr. Basola Jukutu. I'm the Commissioner of Public Health of the City of Boston and the Executive Director of the Boston Public Health Commission. This afternoon, I am going to focus on BPHC's behavioral health, recovery, and related homelessness initiatives. In FY23, we expanded our behavioral health work both the direct services within BPHC's programs as well as on a systems level. We also continue to advance a public health informed response to homelessness and substance use disorder in close coordination with the Mayor's Office of Housing, the Coordinated Response Team, and other city departments, providers, and many other partners. Next slide. As you all know, behavioral health work is not a new focus for the Boston Public Health Commission. We have long provided critical behavioral health services across bureaus and programs, and much of this work has been expanded over the years. Here are our 6 bureaus, and you can see some of the mental health services and behavioral health services are provided in each in a variety of different programs. So I'd like to highlight some of this work, and certainly we'll be open to taking questions when we get to the end of the presentation. So in FY23, key services that involved behavioral health work included the work of BPHC's school-based mental health teams. These teams include licensed social workers and mental health clinicians who provide direct individual therapeutic counseling to students throughout the school year as part of BPHC's school-based health centers. Currently, we have 7 clinicians who provide services to 8 of BPS high schools. This partnership between BPHC and BPS is an important way that we seek to engage and support youth in addressing their mental health and other vital needs. Secondly, I'd like to mention our capacity building and training initiative. We know that city staffers experience a lot of challenges in their jobs in terms of working with constituents, and some of those challenges involve behavioral and mental health concerns. Hearing this, we leveraged ARPA investments to expand the work of our Capacity Building and Training Institute to increase offerings to city employees. Currently, we're looking at plan topics that may include or probably include trauma, positive youth development, workforce well-being, and racial justice and equity. So right now, this is a project or a program that we're working on developing, and we're in the process of hiring FTE to conduct the trainings and manage programming. We're working with Human Services to inform the development of this effort. And then hopefully before summertime, so before June, we will be releasing an RFP for an evaluation consultant and hiring a training consultant to support our work. Thirdly, I want to mention that recent events that have been highlighted in the media have noted the importance of providing mental health supports to postpartum women. We do a lot of this work within our Healthy Start initiative and Healthy Baby, Healthy Child. What we've noted, particularly in some of the increased awareness that's happening right now, is that there's been little attention focused on postpartum mental health among women of color. So to address this gap in FY23, in our Healthy Start initiative, we piloted a program that partnered with a local business, Little Cocoa Bean, to provide support groups for Black women postpartum, specifically focused on mental health, but also increasing access to nutritional supports and educational classes. In addition, if you look at the Recovery Services Bureau, we have a number of programs that are geared towards, mental health services, and of course, working with substance use disorder and all the sort of core work that we do. We oversee a robust spectrum of work that does focus in specifically on mental health needs and provide services to folks in the hopes that they would enter recovery. Work that you may hear less about is BPHC's Entre Familia. It's a 6 to 12-month residential substance use treatment program providing bilingual and bicultural gender-specific substance use disorder treatment to pregnant women and postpartum women and their children. So this just gives you a general snapshot of what we have been doing within the Boston Public Health Commission in terms of behavioral health. We did talk about a number of these programs this morning, so I didn't want to be duplicative, and I just wanted to point out some of the things that we had not talked about earlier today. Next slide. In response to the urgent need for better coordinated, evidence-informed, and effective behavioral health resources, BPHC established the Center for Behavioral Health and Wellness in June of 2022. The center aims to align, coordinate, and promote behavioral health and wellness programming across Boston, so not just here at BPHC, but certainly amongst our partners and looking sort of across the city. And particularly, we want to build systems to support marginalized communities as Boston strengthens behavioral health resilience. The center envisions a Boston where everyone can achieve optimal mental health and wellness through equitable and trauma-informed strategies. So the center is moving forward a number of initiatives that we think are quite important and have significance, I think, and will be important in terms of providing strategies and interventions to meet the needs of Boston's residents. First, the center is working to widen public awareness of youth behavioral health needs and resources through a planned public awareness campaign. We recently released an RFP for a public awareness campaign to promote culturally appropriate, racially just, and linguistically appropriate methods to engage Boston's youth. The center also aims to increase the number of diverse and accessible behavioral health clinicians. To this end, we also released an RFP for behavioral health workforce pipeline programs. The center also helped to guide and coordinate other behavioral health service expansions over the course of FY23, including the expansion of our capacity building and training initiative, which I spoke to. I'll just comment here that part of the work here is going to expand the trainings that we actually offer and work to build our ability to offer services in more places and to more people around the city. We will also be looking to expand our Boston Area Health Education Center, which will allow us to increase the number of Boston middle and high school students who learn and gain exposure to behavioral health careers. The idea, of course, is to increase the workforce pipeline and to make these careers, obviously something that is an option for students who may be interested. We will also be producing additional resources to expand the reach of the Code Club, which we discussed this morning. And in addition, BPHC's communications campaign will really be expanding a lot of their work with youth, particularly looking at preventing substance use amongst youth in Boston. And in addition, we have been speaking and in close contact with Boston Public Schools. We've talked about this earlier today, and if you have questions, we can talk more about it, but we're looking at focusing our efforts on mental health in a certain number of schools and on looking at the possibility of creating sort of a trauma-informed school network throughout BPS, which will be something that'll sort of be a longer-term initiative, but certainly something that we would like to move towards. And then finally, on this particular topic, I wanted to note that Boston EMS has made impressive advancements in the provision of patient care in the setting of mental health crisis, implementing a new mobile integrated healthcare program to address behavioral health needs, which you will hear more about when EMS provides testimony at their hearing on May 16. Next slide. So turning to substance use disorder and homelessness, certainly we talk a lot about the work in the Mass and Cass area, but this is a citywide issue. In FY23, we adapted and improved and expanded our services and are certainly continuing to work towards maintaining an equity-centered approach. A major step forward in this work has been the opening of 6 low-threshold sites that many of you all are aware of. These sites are places where individuals who are unsheltered with substance use disorder and in many cases co-occurring mental illness, individuals can enter these sites. They're low barrier. You don't necessarily have to be in recovery. And through this work, we have housed or sheltered 545 individuals, and 110 individuals have been placed into permanent housing. I think it's really important to understand what's actually happening at these sites. We basically have developed sort of a network of providers who are, offering services at these types of low barrier sites. And we have a learning collaborative amongst them to share best practices and to encourage better systems of care for people who are living with substance use disorder. We have a novel tracking and evaluation system that measures key outcomes and operational indicators across the 6 sites and multiple providers of those 6 sites. I think that this is a great example of collaboration across city departments. We are working very closely with the Mayor's Office of Housing, the Coordinated Response Team, the Mayor's Office, as well as many different community-based collaborators and housing providers to make this system sustainable over time. And I think that's really our goal. In addition, we have continued to work with individuals who remain unhoused in the Mass and Cass area. We recently launched a case management system, so a team of individuals who identify service pathways for people in the Mass and Cass area. And that's been very important because it's providing one-on-one assessment of needs and then meeting those needs and following those individuals until needs are actually met. We've also piloted an overnight outreach initiative to provide wellness checks, overdose response, and harm reduction supplies overnight when we didn't really have expanded access to do so previously. So this is a new initiative. And I also want to mention, as part of all of this work, BPHC's Homeless Services Bureau has been leading shelter transformation. So essentially that is a citywide effort to make shelters more accessible to individuals with substance use disorder and expanding access to harm reduction services within the shelter system. Next slide. Responding to increasing overdoses amongst residents who are not in the Mass and Cass area necessarily, and particularly residents of color, Black residents, BPHC has expanded its focus on addressing opioid overdoses in the Black community. While in the process of developing a strategic plan, BPHC took direct action in responding to a spike in overdoses in Nubian Square, and essentially worked with a number of community agencies to address ongoing issues, which has meant a lot of community engagement. BPHC convenes community stakeholders in the Nubian Square Task Force, trains area organizations and businesses in overdose prevention and overdose response, targets delivery of naloxone and fentanyl test strips to that area, and provides direct services through an engagement team, as well as operates a day space and has 2 mobile vans in the area. We were also awarded a 3-year grant from the Office of Minority Health in September of 22, and that the title of that grant is Addressing Structural Racism in Housing Access Amongst Individuals Living with Substance Use Disorder and Mental Illness in Boston. The goals of that grant are to increase efforts to develop, disseminate, and evaluate policies and practices to ensure equitable provision of low-threshold housing and related services to unsheltered individuals living with substance disorder across the city, as well as to train community stakeholders and methods for community engagement and reducing stigma around homelessness and substance use disorder. And then finally, BPHC worked to decentralize services across Mass and Cass and ensure that residents can access services in their own neighborhoods. Leveraging ARPA funding, we established 2 new daytime spaces. These are low threshold daytime spaces which offer harm reduction services, medical and treatment referrals, linkage to care, while maintaining reduced barriers to entry. One of them is at Whittier Community Health Center, and the other is at Victory Programs in the Back Bay, or at Boston Living Center Victory Programs in the Back Bay. We also launched 2 neighborhood engagement teams, which engage individuals experiencing substance use and housing issues and refer them to services led by Torchlight Recovery Group in Nubian Square and by the East Boston Community Health Center. So in summary, we have this great need. There's a need to provide more services, certainly to individuals with substance use disorder, but I do believe that Boston is making some real progress, some progress that has been noted outside of Boston, has been noted nationally, particularly with our low threshold housing program. We have numerous strategies, and we do have the potential to make lasting impact in behavioral health, substance use disorder, and homelessness outcomes. I also do want to mention that it is important for all Boston residents to understand that they can access help. We know that there are many challenges that individuals face in regards to substance use disorder, and they should call 311 if they or a loved one or a friend needs help and would like access to services. Our PASS program is available to help, and PASS is the providing access to addictions treatment, hope, and support. Next slide. So thank you again for the opportunity to testify, and I welcome your questions.
Thank you, Dr. Ojikutu. In the order of arrival, who's first? Councilor, we'll go to Councilor Murphy. You have the floor, Councilor Murphy. Councilor Murphy, are you still with us? All right. Then can we go to Councilor Flaherty? Councilor Flaherty with us? Okay. Then can we hear from Councilor Arroyo? You have the floor.
Thank you, Madam Chair. So I'll start with these programs that you are presenting on today. And then I don't know, Madam Chair, I did miss this morning session, but was this morning session on sort of like trauma response and everything else? Or is that a future session?
No, this is it. There were some conversations about mental health, but no, this is the time.
All right, so then I'll keep my first half to sort of the work that you are doing to serve those dealing with addiction, and then we'll do the second half on the trauma response, just to keep relevant to what you presented. First and foremost, I am a large advocate for doing work that is client-centered. And when I was a public defender, that was a major thing that we focused on, which was understanding that all of these individuals, no matter what depth their addiction is at that moment, are individuals, and that they have the freedom of choice, and they may be making bad decisions, but they're human beings, and they are in charge of that capacity to make those decisions. And so I've always seen this kind of work as work to try and be restorative in as many ways as we can. And so sort of two questions that are very open-ended, and you're going to be able to answer it from both directions in terms of how you want to answer it, however you want to answer it. One of the things that I find is often levied against programming like what we are trying to do is the idea that it's a waste of money, or that we are that it's money that can be used in other ways. One of the things that I know CPCS, which is the Committee for Public Health Services, had studied was how much money we spend by not doing these things. That often there is a cost to our emergency rooms, to our hospitals, to our judicial systems, that it's actually more expensive to not try to treat this through transitional housing or through these different methods than it is to try to treat it through those. And so whatever data or studies that you are aware of to that effect, I would be very interested in. The second one is, I think there's this idea that because we provide resources, that then means more people come to receive those resources. And so it's sort of a never-ending line, so that if we provide these resources to folks like transitional housing or things of that nature, that people just keep showing up because we are providing services for treatment. And my response to that is sort of, okay, so like these human beings in need, and I would like to make sure we are providing resources to them. I understand that we don't have endless, limitless funds, but when a human being needs housing or a human being needs healthcare and they are here in the city of Boston, we should be trying to figure out ways to provide that. So I'm less concerned with that. But I think one of the questions I would have for you is, what are ways in which we could push, either on a budget or a capacity issue, to further address this issue in a faster timeline? Is there a way to make it so that folks who are entering into this permanent housing, I think I saw on the side it was about 100 people got placed into permanent housing, and I'm sure there's a number of factors that go into that. In what ways does budget and budget capacity into that? And how would we have more folks who are finding sort of, I consider finding housing, permanent housing, a job well done and a step towards sort of receiving the treatments that they need? How much more capacity do we have to have those kinds of success stories with a larger budget? Is there a place where that's related, and then is there a place where it sort of plateaus, where the larger budget doesn't really have an impact on the outcomes? And so just those two things.
Okay, so thank you, Councilor Arroyo. So I'll start with the issue of the cost effectiveness of harm reduction. It's a great question. I've read the studies. I don't have the numbers right off the top of my head, but what I will say is this, that years of evidence and research have proven that harm reduction saves lives, and it specifically in relationship to cost, it reduces the spread of transmissible diseases, particularly HIV and hepatitis C. So I'm an HIV doctor. I treat people living with HIV with antiretroviral therapy. They're on that for life. And if you can imagine lifelong treatment with very expensive medications, continual monitoring, and increased risk for morbidity, leading, other associated illnesses that go along with HIV, obviously saving that money and, reducing that cost is important, and it is been enormously helpful for our healthcare system. Hepatitis C, in most cases is treatable, but it is also an extended period of time of expensive medication. So whatever we can do to avoid HIV and hepatitis C, we should be doing. I would also say that, sometimes people sort of think about these infections as, being a thing of the past. That's not the case at all. We talked this morning about the HIV epidemic and uptick in cases that's happened in recent years right here in Boston, and certainly in other areas, outbreaks that have been discussed and have been published in other areas around Boston, or around the state of Massachusetts. So these are important pieces, and if that's how we sort of justify why we do it, I think it's just important that we're just reducing suffering. What we're trying to do is keep people alive and keep people free of long-term or serious infection, so that we can intervene and do things with them that may move them closer towards recovery if that's where they want to go, and if that's where they end up. So that's why we do harm reduction, or a major reason why we do harm reduction. And I would also say that just the amount of money that we're spending on harm reduction, it's not that significant. Most of our harm reduction efforts are funded by State Department of Public Health, the Office of HIV/AIDS, or the Office of HIV/AIDS at the Department of Public Health pays for most of our syringe services. It's $1.4 million. We also get money for Narcan, to reverse overdoses and other services. So I do think that it's well worth it. The second question is, what could we do in the shorter term, or even the medium term, to get people further along the line, to move them through this transitional housing? I think that's a great question. It's one that we're working on, because we want to actually analyze the data to figure out why it is that more people haven't gone on to permanent housing. I think the easiest answer is that if we don't have enough permanent supportive housing, it's not that. Part of it's that, even if there's permanent housing, it's not necessarily supportive housing. You have to consider the fact that a lot of the folks who are entering into these spaces aren't necessarily ready, or either physically, mentally, psychologically ready to live completely on their own. They actually need supportive services when they go into more permanent housing settings. And this has been a challenge. I mean, our system doesn't allow for the fact that recovery is a long-term journey, and a lot of people are still using or struggling or going between medication for opioid use disorder to using, it's complicated. It's very complicated, and our system just hasn't reached the capacity that it needs to be at to manage complex individuals like the ones that we are trying to assist on the street. So just not having enough of that resource and having a system that doesn't have the capacity to help has slowed things down. So if there's money, but there also needs to be the will to change our system to meet the needs of very complex patients. So I hope that's somewhat helpful.
Just one clarification question. When we talk about the complexity of folks, in my experience, what that really means is folks who are dealing with both mental health diagnoses as well as addiction issues that are either substitutes for treatment for that mental health that they are using, or sort of part and parcel with that, but it means that you have to essentially treat both of them at the same time, which is an incredibly complicated process to.
There's that. There's also that a lot of the folks out there also have a lot of comorbidities, other chronic medical illnesses. So there are people, like I said, living with long-term HIV. There are people who, have diabetes. There are people who should be under medical care. Things are complicated out there. So.
And so that is but to be clear, when you're saying complicated, for the most part, you're speaking about those comorbidities and that dual sort of mental health.
Yes.
Perfect. Thank you.
Thank you, Councilor Arroyo. Councilor Flaherty was trying to get on and extends his apologies. He's having technical difficulties, and I guess we'll circle back to him once he jumps back on. Councilor Orrell, you have the floor.
Thank you, Chair. Thank you, Dr. Ojikutu, and the team at PHC. My question is around BHA and their age strong community, like the senior living. We just, when I go out and visit those sites, they talk about, they're requesting more services, more support services, more mental health services, more senior services. You talk about what type of investments, initiative, programming that we're doing with BHA around our age strong community population.
So I think that's a great point. When we established the Center for Behavioral Health and Wellness less than a year ago, we did intentionally focus on youth. And largely that's because limited amount of initial funding, really wanting to get work done, get things out there, really address an issue that we knew was pressing, and that's not to say across the age span, certainly mental health, behavioral health are issues. So I think that's part of the answer I want to, sort of explain to you. These were some ongoing discussions that we had about where we should invest and where we should start first. Our plan is to expand. The Center for Behavioral Health and Wellness will last. We hope that, we'll have funding to move in other areas and do more work. Most of what we've been doing with Age Strong and partnering with them on has really focused in on COVID-19 and flu vaccination and ensuring health literacy and some of that work. But I know that is mental health is another critical area, and we have been discussing those issues with both, Age Strong and with other elder service organizations.
Thank you. So it sounds like a pilot program is in a very, very premature initial stages, or something.
I would say that we're not even there. Yeah, we're not even at the point of pilot. I think we need to figure out, kind of where the money would come from, what any sort of programming would look like. But it's a need, and I agree with you.
And then my last question is, let me just grab my notes real quick. No, Chair, I'll wait for the second round. Thank you.
Thank you, Councilor Orrell. Councilor Lara, you have the floor.
Thank you, Madam Chair. So I guess when we're talking about behavioral health, obviously my focus is really around the trauma response. And so I would like to hear more about what changes are being made to the model and what kind of expansions are we making or investments are we making in that model. Would be fine to see increases in the financial resources that are going into the neighborhood trauma teams, but I do think that the model specifically right now is not, it's not as effective as it could be. And so are we making any investments in transforming the model? or in the neighborhood trauma teams at all? And if you have information, if you can share some information about how many people you're serving currently, how you prioritize the cases that you respond to, how many people are in each neighborhood, and so on and so forth.
That's a good question. Let me just open up one other document that I have here just so I can give you numbers.
Yeah, thank you.
Just one second. Okay, so I think the biggest change that I want to express, and I think most of you all are aware of this, is that the city is doing strategic planning around violence as a whole. So just running the gamut from prevention to intervention to tertiary prevention, meaning longer term and folks who have already either been perpetrators of violence or victims in community stabilization, post-traumatic events. So there's that piece, which I think is really important. It's a process. It's been ongoing for a number of months. And there's been training that's gone along with it. And I've participated, numerous folks across the city departments and in our Division of Violence Prevention have participated. In regards to the neighborhood trauma team, one point that has arisen that has been proposed as a new investment is ensuring that somebody is available on call to respond to residents' needs 24 hours a day, 7 days a week, 365 days a year. Now, that was the intention, for somebody to always be there. If you experienced violence or you heard gunshots, somebody was shot and you yourself need support, then, you need, psychological first aid and so on and so forth. Somebody should be there if that is the program that we are funding. And so we actually had to make some adjustments, and we have now, as a proposal, been funded to have this 24/7 call response worked into the neighborhood trauma teams. Now, is that all that needs to happen with the neighborhood trauma teams? I think that...
And when you say, and I'm sorry to interrupt you, when you say having this 24-hour response, are you saying having one person that's on call 24 hours a day? Are you having each person in each neighborhood? What does that look like?
Right, so I'm just going to pull this, put this in another document. Essentially, the idea is not yet exactly how many people. The point is to have additional support in trauma response, additional FTEs. It's still being determined. It looks like we asked for $200,000 to support overtime for folks, or potentially additional FTEs for folks to be available when there is a traumatic event that occurs. So that is what was asked for. What I was wanting to say is that all that necessarily needs to happen? I think that there is part of the strategic planning process is to think about how things may potentially be different and how, what gaps actually need to be filled. So that is what is going on with NTT currently. Oh, okay. And I can also tell you how many people have been served.
Yeah.
So in FY23, for the neighborhood trauma teams, we provided support to 97%, so 126 incidents of gun or stabbing related incidents citywide. 587 residents impacted by trauma received stabilization, short-term or long-term support services. So those are the sort of monitoring and evaluation data that we collected.
And do you know if responding to these means that folks were at the scene, that they responded to the family members, that they went after the incident, that they went a couple of days after the incident?
So I don't have each individual incident to be able to comment on each individual, but that is what this means. Essentially, there was some contact with a resident who reported that they were impacted by violence. It may have been immediately that day, but it could have been, a long-term.
So not necessarily the family or the victim themselves, but just the resident.
Not necessarily, exactly.
That was impacted by it. Okay,
exactly.
That's good to know. That makes a lot of sense. Okay, so I think I know that we've been in conversation with Isaac Yablo, who's the mayor's senior advisor for community safety, and I know that this is a part of the violence. And so do you have, and I know I have actually received something from Isaac in the last day, so I want to make sure that I read that. I don't want to, the questions might be answered there, but what is in terms of BPHC's role in the violence prevention plan for behavioral health, do you know what is being proposed? Or what kind of increases, even if it's not the neighborhood trauma team, what kind of other increases are being proposed for this plan for BPHC?
Sure. So I won't, so let's put the neighborhood trauma team aside. We asked in terms of new investments for several additional enhancements to our programming. One is the Men's Health Initiative. So as you probably know, that this SSYI is our sort of case management outreach, direct interaction with folks who are high risk and have been identified by BPD. Our problem with that is that it does great work and it has been well evaluated. I mean, there's a published paper on how effective it has been, but it's only focused on 17 to 24-year-olds. So there's a cutoff. So we piloted the Men's Health Initiative, which basically enrolls anybody over 24 with no age limit. And I believe about 68 individuals were enrolled in that program. Similarly, these were individuals high risk of being either a victim or a perpetrator, and they were, offered job training, mental health supports, other social services. And as it appears right now, it seems that the work that was done, this is obviously just a pilot, a small group of people, it is successful and likely will be similarly successful as SSYI has been. So we asked for funding for that. It is not in our new investments at this time, but that is one of the programs that we asked for. Secondly, we also asked for money for VIP, which is another one of our programs that focuses on primary prevention. VIP is the Violence Intervention and Prevention Program. It works to prevent violence by building and sustaining communities. So it really is about empowering communities to prevent violence in the first place, knowing what we know about the root causes of violence. They use trauma-informed community engagement strategies. They also do a lot of work with youth in communities. And works in 6 micro neighborhoods throughout Boston. The idea with the additional funding is that there is no VIP program in Hyde Park or JP, and as we know, there are areas of those neighborhoods where we know that there is violence that has occurred. So the idea would be to grow the program and actually have programming in those 2 neighborhoods.
Thank you, Madam Chair. I think am I on my time? You're on mute.
You are, Councilor. Did you have one final question?
No, I have more. I have programmatic questions and I can do them on the second round. Thank you, Madam Chair.
Okay. Thank you. I think that's it for the first round. I will now go to our public testimony. Councilor, are you sure you want to wait?
Oh, okay. Yep. So let's go to our. Sorry, I thought there were other people in front of me.
There aren't any other people in front of you, but that wraps up our first round. We're going to testimony. If you have 1 or 2 questions and you wanted to do that before public testimony, since we have such a large list.
Great. I will do that then. So there are 2 questions, Dr. Ojikutu and anybody here who wants to answer them. As you know, as the chair of the Housing and Community Development Committee, we've been really focused on housing quality and looking particularly at asthma triggers in housing and how, one, we're responding to asthma triggers, but really how we're helping combat those asthma triggers. And so I'm really encouraged to see that the emergency department visits for asthma in children under 5 have stayed at 2,800 in FY23, and that your goal is to maintain them. Is there a reason why the goal is not to lessen the amount of cases?
So, Councilor Laura, my goal would be to eliminate.
I mean, of course. I'm going off the numbers that you're
where are you getting that data from? So we are publishing. Let me just tell you. So, and I explained this earlier. We're publishing our Health of Boston reports.
Great.
It should be published in the next 2 weeks online, so you would be able to view them. One of them is our asthma report. And I know what's in the asthma report. This is
not from the asthma report. This is from the selective performance goals that and so the selective performance goals show the actuals for FY23, and then it has the goal for FY24 under it. And so it looks like they want that the goal is to remain the same. Obviously, I know that our goal is to get rid of them, but for FY24 specifically. And the reason why I'm asking that is because I'm looking here at the Community Initiatives Bureau, and there is asthma prevention and healthy homes funds, and that budget line item is growing. It looks like, a little bit under $10,000. So can you talk a little bit more? And same thing for the environmental hazards line item, same thing. It's growing maybe by 100,000, a little bit under 100,000. Can you talk about what those new investments are for?
I don't know, Tim, do you have the exact? I can tell you that I think we need to wait for the Health of Boston report, so we know really what's happening. But we have asthma, not only prevalence, but we have asthma morbidity. So we have hospitalizations across every age, every race, and I think that is really what you need to be focused in on in terms of thinking about what it is we need to do differently. Just so you know, in FY23, we did conduct 365 asthma prevention and control visits, and you know what the program does. It provides education, support, decreased asthma triggers, referrals to hospitals, so on and so forth. And then we also, of note, trained 55 community health workers in asthma home visiting topics. So I think that that's really important. Tim, do you have any information on new investments in the asthma programming? I don't have that.
Yeah, it looks like that increase is just, it's essentially level funded for this year. It's an increase of 7,300 or so. I'm not exactly what that small amount is. I can find out. But on the environmental hazard piece, or I should say for the total CIB Bureau, that's going up by the 126,000, and that's due to the transfer of the FTE from environmental hazards to CIB around the noise ordinance work that we're going to be doing.
Okay, got it. So the increase is based on work that's been taken up by the Community Initiatives Bureau, not because there's going to be any increased investment in the other programmatic areas.
Correct.
Okay.
According to what I have here is the asthma is sort of essentially staying level funded for
okay.
So, yeah.
Thank you. And my final question is around for the Homelessness Services Bureau. There's an appropriation of about a little bit over $8 million last year in FY23. And so we held a hearing on the Boston City Council sponsored by myself that really talked about homelessness and housing for LGBTQ folks intergenerationally, from young people, queer young people who are homeless, to senior housing, to queer folks who are coming out of incarceration, and kind of really looking at the housing crisis, right? We have the housing crisis, and then we have our most vulnerable communities who are kind of double impacted by the housing crisis, which is folks who are struggling with mental health issues, folks that are struggling with substance abuse, and particularly queer and LGBTQ young people and seniors in the city of Boston. And so I'm curious about what resources our staffing are really needed to address, to look specifically at youth and LGBTQ plus homelessness, and what the Bureau is doing to address these issues of homelessness that face these specific vulnerable populations. And, I've been really concerned about shelters that are affirming and welcoming to queer and trans folks in the city of Boston. And so programmatically, are we making any investments? What does that look like at BPHC right now?
So, Councilor Laura, I think that you're making some very important statements, particularly around the LGBTQ plus population. In regards to our work there, one of the things that we've been doing over the course of the last few months is a needs assessment for the entire city of Boston. And so we have a community working group that has been working with a number of different organizations, LGBTQ positive communities, members of the community themselves, as well as organizations and leadership. And they will have a report that will be coming out very soon. I'm just reading the update. We also have community conversations with trans people of color, native Spanish speaking, LGBTQ people of color, and a number of other groups, as well as provider focus groups. The actual report, it looks like, is going to be available in July. So we have a little bit of time.
And when is the asthma report going to be available too? I know you talked about
that's available. It's the draft is like being finalized now. We will post them once they're formatted by early May.
Okay,
that's very soon.
Thank you.
A lot of things sort of in progress right now.
Thank you.
Thank you, Madam Chair.
Councilor. No problem. I'm going to go to my list, and my most of the people that want to testify today has asked if you are able to come on cameras for the counselors to be attentively listening. If you are able to, please do so at this time. I'm going to be calling in the order of arrival or signage. Malet, are we? Ian, I know you could hear me, but can't confirm. Are we ready for our public testimony? And if so, can we have the first person on camera? Here we go.
Okay, can you all hear me?
Yes.
Okay, perfect. Well, I just wanted to thank everyone for coming and that presentation that happened earlier.
I'm sorry, you have to state your name, affiliate.
Oh, sorry.
And or residence, and then you have 2 minutes.
Okay, so my name is Mahalet, pronunciation in the description below. My pronouns are she, her. I'm affiliated with Boston University School of Social Work. I am a public health social worker, and I am a former resident of Roxbury and Dorchester. And so I wanted to talk a little bit about the proposal that went through for the community-based mental health crisis response model, and how that came about and the importance of implementing that. There have been lots of great work done by the commission, the BEST team, et cetera. And it is obvious that they're very overwhelmed. As a clinician, there have been times where I've called the BEST team and it's taken several hours for them to show up. And again, they're doing incredible work. It's just, they're in over their heads. And I think there needs to be an alternative. There have been times where I've called the BEST team and specifically said, do not bring the police, because I knew that would instigate a situation where a patient of mine would use that as an opportunity to die by suicide, and how that shouldn't be an option, and also risks their own safety in addition. And I think it's important that there is follow through with the plan that was created by community members and stakeholders. I think it's a really good opportunity to demonstrate, yes, we will fund community members to create initiatives, but also listen in addition, because it can send a message that, yes, we can let you do all the planning you want, but at the end of the day, we're not going to implement it.
Mahalet, thank you. That is your time. 30 seconds to wrap up, please.
Yeah, I also wanted to reiterate that the model would only cost $2.6 million, which is a very small fraction of what the budget is for the Boston Police Department. It's equivalent to 2.5 days of funding. And so, you know, it sounds like a lot, but it's actually not very much in comparison. And as a public health social worker, I think this is a very important initiative to fund to protect residents of Boston.
Thank you. Thank you so much. Dr. Ojikutu and Tim, if you feel you need a response, just let me know and I'll allow you the time. There will be some questions that I'll be asking you to respond to. Ren? Is Ren with us? There you go. Please state your name and affiliation and or residence, and you have 2 minutes.
Thanks. My name is Ren Hillinger. I'm a Boston resident. I live in West Roxbury, and I work in Hyde Park. I am here to testify in support of the funding for the community-based mental health support model. I am a survivor of intimate partner violence, and my partner at that time, we lived in Boston, and this is someone who, you know, threatened me, but also threatened a lot of self-harm and suicide, and I did not feel like I could call the police because I knew, first of all, this was someone who I loved very much, and also someone who was multiply marginalized and had trauma from police, and also had some trauma from the mental health system, had a lot of mental health challenges. And so having a model that's really community-based, where community members are trained to intervene in these situations, to really lower that barrier and be like, these are not people with badges, coats, uniforms, like coming for you, you know, these are people in your community. And especially something like intimate partner violence or things we've been talking about, like homelessness. These are like slow motion, chronic emergencies, you know, where building that relationship is so important. And so I really urge you to dedicate the funding for this model. It will make a difference in people's lives and in the lives of people who care about them and that are also impacted by mental health challenges and also emergency response that really backfires and harms the people that it's supposed to be helping.
Thank you so much, Ren, for sharing your story and your vulnerability, and to be able to come here and advocate for others. Thank you. We look forward to more in the future. Next, we have Whitney Golden.
Can you guys hear me?
Good afternoon. Yes. Hi, Whitney. Your name, affiliation, and address, please, or just residence. City, where you're from.
Gotcha. My name is Whitney Golden, and I'm a social worker at a local community health center located in Boston. And I am here providing testimony today in full support of fully funding at $2.6 million, the pilot for the community-based mental health crisis response. I was one of 14 community members that worked alongside the City School and Boston Liberation Health to design the community-led mental health response. Being that I am a BIPOC resident of Boston and a social worker, the idea of something like this being offered in the city really rang true to me. This kind of response has some key components that I believe will contribute to those in need, along with their family and friends, feeling better supported in their search for support and care. One of those components are no police involvement. Speaking from personal experience, I have worked with young people and families that are hesitant and sometimes avoid altogether seeking support for themselves or a loved one due to police involvement. I have firsthand knowledge that people have felt unheard, have bad past experiences, or feeling unsafe and victimized at a vulnerable time in their life. I had a family I worked closely with show me a video where the mother was seen yelling at the police that her child needed mental health assistance, and you can hear the fear in her voice as she tried to ensure his safety and well-being as the police interacted with him. I bring this example up because that should not be the case for any human being experiencing a mental health crisis or having to bear witness to one. I also say it because I want to distinguish intention from the impact. In this example, I am equivocally attesting to the negative impact that this encounter had on the very person the police were called to help. Whereas the impact of programs like this one we propose today are restorative on different levels and have a hand at helping such individuals get what they need so that they themselves can start working toward making themselves whole. In addition to the no police involvement, another component that I think enhances this mental health crisis response is that the plan seeks to hire BIPOC people with lived experience, and community members. The importance of these components are to ensure that the people serving the community come from that community, have a comfortability and connection. In my personal experience, this is important in the therapeutic encounter because it allows for a potentially in-depth, unique, and safe space for seeking assistance. Again, I implore you to fully fund this mental health crisis response. Thank you.
Thank you so much, Whitney. Thank you for your work. You guys are lifesavers. Thank you so much. Next, we have Hussein.
Hello. If it's all right, we would like to go by the order that we've shared with your team, starting with Dawn. I think Dawn should be in that list.
1 second, let me verify. So, Hussein, the list that I have for public testimony is everyone from this name down. So, Daniel, and then Emmy?
It should say Dawn, then Amy, then Daniel, then Hussein. If you eliminate the people who just went virtually.
Yeah, no, I have Daniel, then Emmy. Okay, Dawn? Dawn is down the list though. So can we have Dawn on?
Good afternoon, everyone. My name is Dawn Belkin-Martinez, and I'm a clinical professor and the Associate Dean of Equity and Inclusion at Boston University School of Social Work, a resident of Jamaica Plain, and a member of the Boston Liberation Health Steering Committee. I am here today to testify why we need a community-based mental health crisis response that does not involve law enforcement, and to request that the city fully fund our $2.6 million pilot project in fiscal 2024. More specifically, that the funding for this project is diverted from the $450 million proposed budget for the police this year. There are hundreds of reasons why the city needs to fund our community-based crisis response pilot project, outlined and explained in our full report. In my role as both a scholar on mental health practice and a longtime social work educator, I would like to identify three. One, our model would ensure a non-carceral, consent-based service. In my 30 years of teaching and practice, I have heard from thousands of students and service users who are here today that have interfaced with law enforcement's involvement with our broken mental health system. The multiple experiences of lack of trust, coercion, and direct harm that they report have led many to refuse to call 911 and to instruct providers to avoid contact with the best team. Two, our model would enable Boston to provide visionary leadership to cities across the nation around a mental health crisis response that is cost-effective and demonstrates best practice. As the co-author of the book, Social Justice in Clinical Practice, we have documented the crisis in mental health repeatedly. The need for anti-oppressive systems of care couldn't be clearer. Traditional mental health services are not meeting the needs of community members. There are programs across the country implementing alternative cost-effective models. Boston can lead around the innovative anti-oppressive mental health care. Third, our model is completely aligned with the city's commitment to equity, inclusion, and justice. As an educator and mental health provider, I know that mental health programs must be collaboratively developed by the people most directly impacted by mental health services. Our pilot was developed by community members, selected by the city, and vetted by hundreds of Boston residents, both service providers and users. It is an optimal anti-oppressive public health practice, and we will all benefit when it is fully funded and operational. Thank you.
Thank you, Professor Martinez. You guys will have to help me with your list and who you want to go next. I have someone from my team contacting you now to get a list, I guess, scanned and emailed to me. And then I'll be able to follow it thereafter. But for now, who's next?
We have Daniel next.
Welcome, Daniel. Your name, state your name and affiliation, and you have 2 minutes.
Thank you. Good afternoon, members of City Council. My name is Danny. I'm a freshman at BLA here today with YJPU. I'm here to speak about the importance of mental health in the crisis response pilot. The mental health response in Boston is inadequate. There have been numerous examples of individuals with mental health conditions being killed by the police. Daniel Prude, March 2020, shot and, wrong person. Burrell Ramsey White, 2012, dead, met with guns instead of care. Manuel Jr. De Vega, 2010, dead, met with guns instead of care. Terrence, 2016, dead, met with guns instead of care. All examples of people being killed by BPD. 3 people dead, all because of inadequately trained professionals. Introduce properly trained people by the community for the community. There have been numerous examples in other cities where programs like this have shown to be effective. Southern California, the CAT 911 program. In the first year of operation in Long Beach, California, 86% of individuals were diverted from jail or emergency departments to treatment. STAR program, Denver, Colorado. Not only did they assist in diverting individuals in the crisis away from emergency departments and jails, they also did this by saving their city almost $1.9 million in the first 6 months. These programs have been proven to be effective in reducing harm to individuals in crisis, reducing the burden on law enforcement, and saving taxpayer money. We are requesting $2.6 million in funding from the BPD budget. By investing in a mental health crisis program response, we can ensure that individuals in crisis can receive the care and support they need, diverting them away from criminal justice and from the criminal justice system and towards mental health services. Thank you.
Thank you so much, Shane. Can we have the next person?
Yes, we have Amy.
Thank you. Amy, state your name and affiliation, and you have 2 minutes. Welcome.
Thank you. Hi, my name is Amy Takanami. I use she, her pronouns. I'm a steering committee member of the Boston Liberation Health Group, and I'm here to share testimony on behalf of our organization in support of fully funding the pilot for the community-based mental health crisis response model at $2.6 million. Boston Liberation Health is a group of health and mental health care providers and service users using an anti-oppressive practice method to advocate for social justice and liberation here in Boston and around the world. Boston Liberation Health was started nearly 20 years ago by a group of clinical social workers in Boston and now has over 2,700 members worldwide. Our theory of praxis posits that problems that individuals face cannot be understood in isolation from the economic, political, cultural, and historical conditions which give rise to them. As social workers, we do not accept the false binary between individual clinical interventions and structural macro interventions. You'll continue to hear from some of my clinical colleagues later on why we need this community-based model based off their professional experience. But as a macro social worker myself, I'm going to briefly add my own perspective. As a macro social worker, I see the community-based mental health crisis response model as an important step in moving upstream, not only through beginning to address and highlight some of the root causes of mental health crises, but also through implementing a truly representative, accountable, and community-based advisory board made up of folks most impacted that can serve as a model for how other public programs should be governed. My perspective has also been shaped by my own lived experience. As someone who had to witness a parent experience compounded trauma through violent interaction with the police, when what my parent needed most was health and mental health care and support in the midst of crisis, my macro social work lens on this issue is very much informed by my own lived experiences. Thank you all again for your time, and I urge you to support fully funding the pilot for the community-based mental health crisis response model at $2.6 million.
Thank you. Say that you next?
Yes.
Okay. Please state your name and affiliation, and you have 2 minutes.
My name is Hussein Rizvi. I'm with the city school, and I've been a youth worker for 6 years. I'm a resident of JP. I'm here today to demand $2.6 million from the police budget for the 2024 fiscal year to fully fund the pilot model of the community-led mental health crisis response. We are here in the Piemonte room, and we are a coalition of young people and organizations that you're going to hear from over the course of this afternoon. We are committed to fighting for the implementation of this pilot. This model was generated over a year of a community-led design process funded by the city. The model is consent-based, free to use, non-carceral, and a non-police model. There is currently no mental health response in Boston that assures that if you call, you will never be faced with involuntary institutionalization. There is no other response in Boston as committed to not calling the police on our community members as this one. As you've heard earlier, most responder teams often call police or arrive with police, and that makes it unsafe for us to call for fear of criminalization and brutality. As a member of the Muslim community and the South Asian community, this year I've seen directly what happens when this kind of resource isn't available. Syed Arif Faisal was murdered by Cambridge police when he was in a de-escalatable mental health crisis, and it haunts me every day to think about how easily we could have saved his life. Personally, there have been instances where I've been afraid to call 911 when friends were experiencing suicidality, and I chose to go to them myself instead of reaching out to responders because I knew I can successfully de-escalate in a way that police or even EMS can't. Fund our pilot model for $2.6 million and show us that you are ready to commit to the Black and brown, immigrant, Muslim, disabled, working class, queer and trans, and youth communities who know how to care for each other best. Thank you.
Thank you, Hussein.
Right. Next up, we have Mel.
Thank you. Hi, Mel. Please state your name and affiliation, and you have 2 minutes.
Okay. Hello, my name is Mel Pham, and I'm a youth leader at V8 representing Dorchester. Nowadays, I've noticed that many authority figures in my life are certified to address mental health issues. Unfortunately, the majority of them are mandated reporters. When I was struggling with my mental health, I did not want to talk about it with my friends. As much as I confide in them, it is not their responsibility to advise me, especially if they are not experienced in mental health crises. I was struggling to reach out for help because all of the resources present seemed threatening to me. I could not feel safe with the idea that information that I entrusted to those mandated reporters could potentially put me in danger. I struggled through a lot all by myself to get back to a good state of mind, and something like the free and consent-based mental health crisis response would have helped me so much back then. And I only asked for 0.007% of the police budget for a pilot to help people that are in the same situation that I was in so long ago. Thank you.
Hello, my name is Nong Quinn. I'm 15 years old and attending John B. O'Brien High School and a youth at .I with ARW. I'm a first-generation daughter of two amazing Vietnamese immigrant parents who have gone through millions of miles of trouble to bring me to a prosperous country that is supposed to be liberating and equal for all. I believe that investing in a mental health crisis response instead of the police will put truth to those words. Because I've heard and seen of too many incidents of police brutality, of people trying to seek safety and receiving more threats from the criminal justice in response. To me, violent interactions with police that no young adult should have to be able to witness. I asked of you $2.6 million, only 0.007%, less than 1% of the yearly police budget to invest in this model, which will be accessible to communities in need like mine, who cannot depend on the police for assistance at all times. Studies have shown that more than half of police shootings victims are those with mental illnesses. This is not coincidental. Unless we do something about this, it is a repetitive cycle of community of colors, victims falling victim to mental illness and being attacked for having such problems by a white supremacist system. I speak from the heart when I say this new system of mental health response is a promise of safety and a dependable source of reliability for young adults and adults alike, people of color, LGBTQ+ communities, immigrants, and as well as any other minority communities.
Up, we have Zykel.
Thank you. Hi, Zykel.
Hello.
State your name and affiliation, and you have
Cameron. Hello, my name is Kel Smalls. I am both the Summer Leadership Program Director at the City School, but also the Senior Organizer at Community Labor United, and a resident in Boston living in Dorchester. I'm here today alongside a multitude of organizations and people who are showing up in the larger and broader fight for racial and economic justice, and see today as an opportunity to participate, engage, and collaborate with elected officials, and ultimately advocate for public funds and public dollars that move towards the public good. I read this testimony in full support of full systemic oppression, and other causes that are really at the root causes of mental distress and mental illness. If it were not for us today, there would not be over 40 to 50 community and Boston-based residents mobilized and showing up for this hearing today, in the midst of a virtual change, speaking on this issue, regarding our advocacy towards mental health without the use of policing. We know that in order to do justice by all peoples, and especially young people who are really showing up in leadership today, we need to dig at the root causes of mental health as a social concern, not just a medical concern. And if we view the mental health crisis in our communities as such, we need a community-based model. We know that the city is working and implementing towards another mental health crisis response program. However, we really want to identify the difference and begin to articulate a new possibility moving forward for the models that our advocacies and communities need. We need fully funded community-based model in an effort to address and implement a model that is effective and has been proven to be so. Thank you.
Thank you, Zykel.
Next up, we have Joaquin Atala. Hello.
Hi, please state your name and affiliation. You have 2 minutes.
Good afternoon. My name is Joaquin Atala Gutierrez. I'm a proud Palestinian Mexican American. I am 14 years old. I was born and raised in Boston. I go to school at Boston Latin Academy. I want $2.6 million from the police to go to a community-led mental health crisis response. From day to day, I see people who could use support around where I live in Hyde Park and around where I go to school in Roxbury. If someone in my community is struggling or out of touch, the last thing I want them is to be harmed by police. I want them to be met by community mental health responders. As a Palestinian American, police here and in Palestine are rooted in systems of racism and oppression. More than 1 in 5 people killed by police are mentally unstable. Too much money goes to the police in the first place, and we are only asking for less than 1% of the annual police budget to go to mental health. We have had this system for far too long, and it's time for a change. Therefore, we should defund the police and give $2.6 million of the police budget to go to community-based mental health crisis response. Thank you.
Thank you, Joaquin.
Next up, we have Devin next.
Welcome, Devin.
Thank you. Yes, my name is Devin Atalla. I am a psychologist, a resident of Hyde Park, father of Joaquin. And yes, so here in my testimony, I'd like to say that as both a clinician and a researcher who's provided crisis mental health interventions and care for decades here in Boston, it's important to understand that I'm speaking, of course, as someone who holds in my body the decades of what it means to do this work. And also, as my son said, as a Palestinian, I know the ways in which policing becomes surveillance, becomes oppression. From Boston to Bethlehem, Jerusalem and beyond, it's reckless the way that Boston City continues to put money into policing who collaborate with the colonial nation state of Israel. Right? This is a transnational problem And it's reckless to continue to pour money into it. So I'm saying I'm saying this as a community member, as a clinical psychologist, as a therapist, as a professor of psychology here in Boston. My field has historically supported the state violence of policing. And so I stand against that as well. And I hope you join me and other psychologists, social workers, and mental health care providers who say enough is enough, right? That the policing creates negative outcomes rooted in anti-Black racism, rooted in colonialism. And we know that victims of police state violence have increased rates of suicidality, have increased rates of depression, PTSD, and anxiety. And these are not just from encounters with police that are visibly or notably violent, but police encounters that might seem very benign to police officers, right? But that do not feel benign in our bodies and in our families and in our communities. So, and when it comes to police shootings, as other young people have already voiced here, at least a quarter of fatal police shootings are against individuals with mental illness. In some estimates, it's much higher, close to 58%, right? We know that when police actively harm those with mental health concerns, that this is systemic. It's not coincidental. The police system's consistent violent actions against those of us with mental illness means that divesting from police into mental health response is a community safety strategy. We demand that you act, you place the $2.6 million into mental health care response and bring the much needed care to the most vulnerable residents in our communities. We can do this on the ground. We have the knowledge, we have the capacity. We need you to step up and act. Divest from police, invest in community. Thank you.
Thank you.
Up next, we have Amatsala.
Hi, my name is Amantala Mervin. I'm the outgoing executive director of the city school, representing all of these lovely people in support, and that's located in Dorchester. One of the organizations alongside Boston Liberation Health that work to support community members in developing the mental health crisis response model. I implore the Ways and Means Committee to strongly advise the budget to include $2.6 million from law enforcement budgets to be used for the mental health crisis response pilot and program. Our proposal is a non-carceral model that is free to community and built and led by community. We know that people, especially in communities such as Roxbury, Dorchester, and Mattapan, are suffering with mental health crisis that policing is not equipped to supply. As we know, mental health issues, substance abuse dependence, et cetera, are public health issues that should be addressed directly by community. They affect the lives of our constituents and your constituents and those you serve. As a youth worker for over 10 years, I see every day the impact of youth and their families in community not having access to safe spaces or community to be supported. The mental health crisis response pilot is a radically different approach based in justice and the humanity of people that will positively support our city and the work that we are doing. To me, this is not simply an option, but the only viable way that does not add a Band-Aid to the problem and the long suffering of Black and Brown communities especially. I ask that you not only fund the pilot, but the model. Fund the model. As a commitment to our communities and as a commitment to yourselves and the communities that you help to represent. Thank you.
Next up, we have Charming.
Hello, my name is Charming Salamang, and I'm here representing Dorchester and Beantown Society, and I will be testifying today. So there used to be a time where I didn't understand the kind of services police officers provided to community. When I was a kid, I was taught that they were supposed to serve the people, protect us, and de-escalate serious situations. But as I got older, I started to understand the reality of the situation and what police officers actually did. I started to understand that the only groups of people police officers were here to protect and serve were white people, given the messed up structures the police system was built from. The reality is, police have killed and incarcerated thousands of innocent Black and brown people. When our community calls them to respond to either violence or mental health crises, they take a long time. When they do show up, their approach is to meet community members with violence, with punitive consequences, or with fear. I'm here advocating that we take $2.6 million from the police budget and redirect that money into the community-led mental health crisis response program. We need, we want, and we deserve community members with shared identities and experiences to be trained to respond in a way that is effective and transformative for our community. We do not need any more structures that come from white people on how to keep our people safe. We need these structures to be made by the people for the people. Thank you.
Thank you, Charming.
Next up, we have Chloe.
Good afternoon, Councilor Anderson and City Council members. Thank you for having us. My name is Chloe Frankel. I am a clinical social worker, a resident of Jamaica Plain, and a member of the Boston Liberation Health Group, and was also honored to be part of the facilitation team for the community design process. I want to speak today echoing what my colleagues here have said and calling for $2.6 million to be 2.7, sorry, moved to from the BPD budget into the community-led mental health crisis response program. As you've heard from folks today, we know that crisis response must be rooted in trust, relationship, and consent, and that everything leads to worse outcomes when that is not the case. Part of what I want to talk about today is prevention and diversion. One of the issues is that when people don't know who's going to show up, or they worry that the person who shows up is going to make things worse, they're less likely to call for help. I was very pleased to hear Councilor Arroyo earlier talk about prevention and diversion, and I want to highlight that there is already a precedent in Massachusetts for effective, cost-saving, voluntary, community-based mental health services that preserve the dignity of those receiving services. I've been practicing as a community-based social worker for over 15 years, and many of those years I was part of an in-home therapy or family stabilization team. These teams were developed as part of a continuum of care in 2007-2008 as part of the Children's Behavioral Initiative in Boston and throughout the state. These teams meet with clients at home on a voluntary basis to provide therapeutic support and crisis response, and importantly, to build relationships with folks before crisis moments are reached. I know, Councilor Anderson, that you're a fan of facts and figures. So there is a lot of data available on mass.gov showing that year after year, these programs have reduced the need for inpatient hospitalization and or ER admittance by over 50%. And a study conducted by the National Technical Assistance Center for Children's Mental Health estimates that in Massachusetts, costs for families receiving CBHI services compared to other families were reduced by 40%. So there's really clear data showing that these are cost-saving measures through prevention and diversion. I want to be clear that CBHI is not the same as the model that we're proposing. They do have a parent-partner program, and they do have some components of peer support, but they are not community-driven and community-led. So what we're proposing is really rooted in community and in people trusting that the person who's going to show up is somebody that they know is going to make things better and not worse. At the same time, I think that data is really clear that prevention and diversion really works. We know that this works. We know that this is what community members need and are asking for. And right now, CBHI services are only available to people under age 21. So we're asking the City of Boston to invest in a community-led mental health crisis response model so that all Boston residents can access community-based, cost-effective, trustworthy, evidence-based mental health support, regardless of their age, race, diagnosis, or ability to pay. Boston needs and deserves a fully funded community-led mental health crisis response program. Thank you so much.
Okay, next up, we have JoJo.
Thank you so much. Hi,
Hello,
Joe.
City Council. Sorry.
Hi.
Hello, City Councilors. My name is Joaquin Lambos. We are here today demanding the City Council take $2.6 million from the police budget and put it into our pilot for a community-based mental health crisis response. As a young person who has seen young youth deal with mental health crisis, seeing youth refuse to call for help, refuse to call 911 or a suicide hotline, and skepticism and even fear of what would happen to them if they did. More than 20% of people who were fatally shot by the police were experiencing a mental health crisis. Just earlier this year, Saeed Faisal was shot and killed by the police while experiencing a mental health crisis. Would you send a nurse into a burning building? No. You would send a firefighter, someone trained for that specific situation. So then why are we sending police to deal with mental health crises instead of trained professionals that know how to deal with the situation? The police are not reliable when a mental health crisis is happening, nor do they put us at ease or make us feel safe when having a mental health crisis. We know that there are plenty of police officers of color who have deep roots in our community and agree with the fact that things need to change. The police budget has gone up by $10 million. For what? We are asking for only 0.64% of the police budget to let us run our pilot for a community-based health crisis response. Thank you.
Thank you, Joaquin. I would add to Chloe's testimony that CBHI is also only provided to people that actually have the diagnosis, and that's one of the issues, isn't it? Is that a lot of people who don't have access to these services may be facing situational, circumstantial, temporary just diagnosis that may, in the long run, not deserve harsh diagnosis or may not even need a diagnosis. But there are no services through any insurance that will actually allow you to be treated or to be seen or addressed or your issues addressed without a diagnosis. One of the dangers of always labeling our young people in society, we need services that would be able to address these issues or circumstantial situations without diagnosing a youth.
All right, next up we have India.
I'm India, a Dorchester resident representing the city school. By implementing the community-based mental health crisis response, Boston residents will have the ability to report mental health crises to professionals without fear of police violence or abuse of power. I demand $2.6 million to be allocated from police funds into this model in order to uplift those in our community who will benefit the most, including those struggling with mental health, people of color, and the LGBTQ plus community. By implementing the crisis response and allocating funds with this response team in Warm Line, youth will have access to a free, confidential outlet for their experiences. Thank you. Thank you.
Okay, next up we have Kyra.
Hi, Kyra.
Hi. Hi, my name is Kyra. I'm a 15-year-old resident here in Roxbury, and I work with YJPU. I lived here my entire life, and I've witnessed my own peers in need of mental health care, but has had nobody to actually help them in the ways they needed, and have had their lives changed for the worse because of the system we have now. So when I say that I know firsthand that our community is in need of better mental health crisis responders, I mean it. So what we are in desperate need of is to take $2.6 million from the police overtime budget and work on a better mental health care system, one that has no police officers and more of our community members that will understand what we are going through and can be calm with us and have compassion and sympathy, so our community members in need feel safe and can get the help they deserve.
Next up we have Khalil.
Hey, y'all.
Hi, Khalil. Nice to see you.
Nice to see you. My name's Khalil. I'm a lead organizer for YJPU, the Youth Justice and Power Union. I'm 25. I'm from Roxbury. I'm here today in solidarity with the City School, Boston Liberation Health, and my community. We're demanding fully funding the pilot for the community-based mental health crisis response model at $2.6 million. And we're asking that you move that money from the police budget into the model. I believe that if community-led crisis response got the structural and financial support that police receive, we could save so many lives. I've seen the police murder someone during a crisis. I've been in situations where I don't know who to call when someone I love is in pain and my only options are carceral. We need to fund things that move our community towards love and support. We can't continue to murder and lock away our people who are hurting and in need of help. I'm deeply displeased that the chambers are not even open today. But as you can tell, with our full room of people, I don't know if y'all see all these people. We have a lot of people who are in support of this model and a lot of people who are unhappy with our current carceral model. So I urge you to fully fund the pilot for the community-based mental health crisis response model at $2.6 million. Thank you for your time and consideration.
Next we have Maya.
Thank you, Khalil. Maya, allow me a moment, please. Khalil, and to everyone in the room there, I sincerely apologize for having to do this remotely. I think there was a miscommunication on which hearing is remote. I have scheduled the hearing for BPD in person and in community. Looking forward to collaborate, to organize everybody to come back. Hopefully, maybe it's out of school, maybe it's somewhere convenient for you. We want to give you access and make sure that it's convenient. So let's do this again. Let's slow down the conversation. Let's make sure that we are emailing the counselors. Counselor Lara is still here listening and supportive. Look forward to making sure that we engage you and have people listen to you.
I don't know if you heard her, but Laura said she's here.
She's there. She's there in person across the hall. And is she in the room? You're awesome. Okay. Thank you. And thank you for Tim and Dr. Jagutu for being so patient in listening. Okay, next person, and we'll get through this.
Thank you. Hi, my name's Maya. I'm a JP resident. I'm a steering committee member of Boston Liberation Health. I'm on the steering committee that facilitated the design process of the community-based mental health crisis response model. I want to name that there are many more community-led design group members who aren't able to be here today because they couldn't take time off work, especially after some of them had already taken time off for a third scheduled meeting earlier in the week with the mayor's administration that didn't end up happening again. The CLW as a whole continues to be committed to this model happening and to getting the $2.6 million for the pilot. I want to share from my perspective as a licensed clinical social worker who's worked in the field for 10 plus years, the majority of which have been doing community-based and in-home work. I've worked with many folks navigating mental health crises, and I've both witnessed and heard countless times about the harms of our current response systems, including both the police and the BEST team. Responding with guns and badges only escalates the crisis and further traumatizes someone. The BEST team frequently calls the police, so the city's proposal to increase coordination between EMS and the BEST team as a quote-unquote alternative model is not actually anything different than the harmful responses we already have. Community members who are most at risk of the harms and violence of a police response would still be at risk. Even when the BEST team does not involve the police, they still often engage in non-consensual practices, including forced hospitalization. This practice is re-traumatizing, akin to imprisonment, and research demonstrates that forced hospitalization increases, not decreases, suicidal ideation and attempts. The community-based model would not involve law enforcement and was designed by and prioritizes communities who are most impacted by the current police response model. A core value anchoring the model is that it is consent-based. Trained community members responding to other community members in crisis would focus on providing the care that someone needs and consents to in a moment of crisis, as opposed to prioritizing liability concerns, as many BEST team responders do. We are asking for a fraction of a more than $1 million a day BPD budget, so the equivalent of less than 2.5 days of their budget. Please put $2.6 million in the FY24 budget towards the pilot for the community-based model. Thank you for your time.
Thank you.
Yeah. Next, we have Sashi.
Hi.
Hi.
Hey, girl. How are you? Thank you, Counselor. So nice to see y'all. And you too. My name is Sashi James, and I represent Families for Justice as Healing and the National Council for Incarcerated and Formerly Incarcerated Women and Girls. Our mission is to end incarceration of women and girls and I live in Roxbury in the middle of the most incarcerated corridor of the Commonwealth. This corridor lacks resources for mental health, substance use, housing, food justice, adequate education, and much more. This is a potion of oppression. Families for Justice as Healing and the National Council has been on the ground for years, led by formerly incarcerated and directly impacted women, grandmothers, mothers, daughters, to create what different looks like, shifting the narrative of what true public safety looks like in communities that are forced to believe safety comes from the exact system that was built to control, oppress, and cause further harm. Now is the time we listen to what the people want. We want the police out of our neighborhoods. We want the gang unit out. We want special security out. And we want investments in. We want programs of safety to be led and centered around community members that represent what the community looks like. Organizations have come together with a vision of what different looks like. A community-based mental health crisis response model is one tool that helps the city of Boston control police deployment, because as a Roxbury community member representing D7, I am tired of the police showing up to my house because my daughter is having an asthma attack. Supporting a community-based mental health response model also gives jobs, training, and opportunity to explore a different career path to the people in my neighborhood. And more importantly, it allows us to feel safe when we are being saved by the people that look like us. I believe that the demand for $2.6 million should go directly to the community organizations creating these models. However, I understand this pilot model as a start, which is groundbreaking. In closing, community members are working to dismantle piece by piece the police budget because it is an ineffective system that continues to be fiscally funded irresponsibly. Also, I'd like you to know that if this community-based model is not supported, it will happen anyway. Change is now, and change cannot be stopped. We, the people in this room, virtually and beyond, are the evolution. And although we are here asking for this model to be funded, Families for Justice as Healing and the National Council is truly proud to say that we are already sending our first round of community members through a local community-based EMT school to begin the development and implementation of what a community-based crisis response team looks like through our infrastructure of reimagining communities. Yet we are here in full support and position to build solidarity as we call on the city of Boston to finally put the people first by funding the vision of the people. It is time to move with the people or move out our way. Thank you. Thank you for hearing us, and thank you for all the orgs and people standing as we demand change. Thank you.
Thank you so much, Sashi.
Hi, my name is Shania, and I'm 20 years old, and I'm with the Beantown Society organization today. And I strongly believe that the mental health crisis response should be implemented in Boston because I've witnessed scenarios where the police have escalated situations that don't need to be escalated. Police have inflicted more harm in our community than protecting it. Police harm is not okay, and I would expect that they do their job right since they're getting paid millions of dollars to do so. $405 million to be exact. And I'm demanding $2.6 million from the $405 million budget. The $2.6 million would instead go to experts in the community who are trained to de-escalate mental health crisis situations. So again, we demand $2.6 million from the police budget. Drops my.
I appreciate the mic drop. Thank you, Shania.
Next up, we have Christian.
Hello, my name is Christian. I'm from Roxbury. I ask that you divest $2.6 million from the police budget to the community-led mental health crisis response. Time and time again, police have escalated matters instead of properly resolving them. With $2.6 million, we could put that responsibility into hands of experts in the community who are more prepared and familiar with these issues. Please, again, divest $2.6 million from the police for the community-led mental health crisis response.
Next, we have Vina. Vina.
Hi, my name is Vina, and I'm a youth coordinator at the Youth Leadership Program at VidAid. I'm also a fellow at the Ella Baker Fellowship and a born and raised resident of Boston. There has been a lot of moments in my family where this response system could have disrupted the cycle of abuse. My immigrant parents are afraid to call the police unless it's a robbery or something outrageous, when in reality, there have been so many violent moments at home that I have normalized in fear of reaching out for help, in fear of calling the police due to mandated reporting and language barrier concerns and immigration issues. Imagine a child at the age of 8 de-escalating two grown adults, projecting generations of violence and trauma on each other. And then we would pretend that nothing happened. Imagine that child going to school the next day with that experience on top of societal pressures to be a good student. I realize now that that is not normal. It is not okay. Situations do not have to shed blood in order for it to be bad and considered a crisis. I work with predominantly Vietnamese immigrant youth who face the same issues at home. Matter of fact, Dorchester is filled with BIPOC immigrant families who face similar issues at home. Mental health is taboo to speak in our culture. Our families deserve grace, healing, attention, and support. We need to work towards dismantling those systems that push us away from taking care of ourselves and healing from generations of violence, from war. We have normalized these things and we have not unpacked these things. The mental health crisis response system is a step toward that for us, and that's why I showed up here today. I am demanding that $2.6 million is taken from the police budget to fund the community-based mental health crisis response pilot model. Thank you.
Next up, we have Zenaya.
Hi, my name is Shania Destiny Noel Lee. I'm with Youth Justice Power Union. I demand that you take $2.6 million from the police budget and invest it into the community-led mental health crisis response pilot. This is important to me because everybody is impacted by mental health. I personally experienced not knowing to reach out when my friend was suicidal. There needs to be a resource outside of police to help teenagers and people who we care about. We need people who genuinely care about the youth and the people that we care about that's going through mental health. People who understand us as youth. Thank you for listening. I know my voice is important. I hope you guys know as well.
Thank you.
Next up is Chloe.
Hello.
Hi, Chloe.
Thank you for having us all today, and thanks everybody else who has been putting this all together. My name's Chloe Ann McElligott. I use she, her pronouns. I'm 29 years old. I've lived in Boston since 2017. It's my home. Sorry. I graduated from Boston City
Take your time.
University.
I got your, no, it's fine. I got your letter. Very
good.
Loved it, absolutely loved it. I was looking forward to reading it. You did great in writing. Looking forward to listening to you.
Thank you. I graduated from Boston University School of Social Work in 2021 with my master's in macro practice. I'm here today as a resident and a social worker to share testimony in support of fully funding a pilot for a community-based mental health response crisis model at $2.6 million. Originally today, I was going to speak more on what I already submitted in the letter. Sorry, I'm getting a little out of my body right now. Because instead, I'd like to talk a little bit from my own heart and my own personal experience. So I'm a little shaky. One of the things listed in the scope of response, great document, you should check it out, is a response to people who've been impacted by gender-related or intimate partner violence. In 2021, I was in need of that support. It's like one of the, sorry. Oh, we're good. It was one of the worst periods of my life. I didn't feel like I had anyone to call. I didn't want to call police, especially, hold on, sorry. Knowing that the police could be involved if I called 911 stopped me from calling anybody, even in my own moment of crisis, especially as a social worker. I couldn't in good conscience call 911, get the police involved and support this, this carceral model. It doesn't work, it harms people. And I also, for myself, just wanted to have someone to call that I felt like I could trust with the complexity of what I was going through. I needed to feel safe, and I wanted the people that were involved to be safe, and police can't be involved. There are other possibilities at our fingertips, at yours. We owe it to ourselves, especially individuals and communities most impacted by policing, to give this pilot and model an honest try. Sorry, I wrote this in my journal, so my handwriting's kind of bad. We can't give it a fair shot without substantial investment from the city. The $2.6 million is a fraction of the police department budget. It's like 3 days. That's wild. So that's it. Just please fund it fully. Give it a try. Thank you.
Next, we have Olivia.
Hi, my name is Olivia Nichols. I live in JP and work with the Asian American Resource Workshop, a Pan-Asian community organization based in Fields Corner, Dorchester. And we organize with Asian and Asian American communities across Greater Boston. We're here in support of the community-based mental health crisis response model and joining everyone here today in demanding that the city and city council move $2.6 million from the police budget to fully fund a pilot year for this initiative. AARW works with Southeast Asian refugees and immigrants who have been over-policed and criminalized by law enforcement that has funneled our people through the prison to deportation pipeline. We also work with undocumented Asian communities who talk about how they envision safety and support looking like for them, and more police was not a solution that they named. What we're asking for with this model is for people of color, especially those who've been the most impacted by the system of policing, to have alternative options for mental health support during crisis without having to seek it from the very policing systems that are compounding harm against our communities. Having this pilot for us at AARW would mean getting to see our communities showing up for each other as crisis responders reflective of Boston's communities and actually offering the kind of care our people need in difficult moments, rather than punitive responses that continue the cycle of mass incarceration and more violence. This city spends $2.6 million on police every couple of days. We're asking you, city councilors, and the city to instead invest at least that amount towards a year of trying out a different way for our communities to seek mental health support with this crisis response model. Thank you.
Next up, we have Elise.
Okay. Hello, my name is Elise. I'm a Dorchester resident, an EMK student, and I'm here with the city school. I'm here to testify $2.6 million for piloting the mental health crisis response. The community-based mental health crisis response resolves issues without guns and incarceration. Instead of having the police respond to someone who is in a mental health crisis, we need responders from our community who support them and resolve conflict without any violence. Many youth at BPS are struggling with a mental health crisis and keep silent and are afraid to speak up, especially to mandated reporters, because they're afraid of having the police called without their consent. They have nobody to turn to. It would be helpful to have someone to listen to your troubles, meet your needs, and respond responsibly without taking you away without your consent or harming you in any way. People who are in a crisis are already hurt and struggling with nobody to turn to. So I'm asking you to fund the mental health crisis response to support us to lift that weight off of our shoulders.
Thank you, Elise.
Next, we have George.
Hi, good afternoon. My name is George Lee, and I'm here with Youth Justice and Power Union and Defund Boss Cops and supporting the community-led design group, the City School, and Boston Liberation Health. I'm proud to be here in this packed room of beautiful people here at City Hall, as Khalil showed y'all, and y'all can keep hearing them clapping. We're demanding that the city moves $2.6 million from the police department to pilot the community-led mental health crisis response model that community members designed over the past year. The City Council must amend the mayor's budget, and the mayor must accept this change, as well as cut the police budget from its ridiculous $395 million instead of raising it to $405 million. The Boston Police Department gets about 100,000 calls a year, including about 2/3 categorized as non-criminal, non-violent, drugs, alcohol, or driving motor vehicle. Many groups, including Citizens for Juvenile Justice, have broken down how we could respond to many incidents without police. They respond to situations such as sick, injured, medical, or verbal dispute. We don't need police in these situations or in mental health crises. We need caring community responders. Like many people, I've struggled when I've encountered a situation when someone needed help, but there wasn't a clear place to call. For example, I've seen police try to kick people off the train when they were intoxicated until I said I would ride with them to where they needed to go. Another time when someone said they needed a ride to their rehab program, I ended up walking with them to the program since calling the police wouldn't have helped. Instead of helping with mental health, the police and prisons break people down. I remember a young person who got out of DYS and was traumatized at his time locked up there, and his friend who didn't have housing but refused to go to shelters because of how it triggered his experiences of being locked up at South Bay. One of the worst situations I've been part of was when the police harassed young people in Bowdoin, Geneva in 2010 after their friend was killed. Young people and community members gathered at the street memorial, and many clearly needed help. Many youth workers do outreach at people's homes and in neighborhoods, including at street memorials, to see what people actually need, helping connect people with mental health support, jobs, housing, helping bring food and water, and holding memorial events. What police do instead is criminalize people. In 2010, police targeted one of the people there struggling with his friend's death, and it escalated. And instead of that police person getting the help he needed, he ended up shooting himself during confrontation with the police. How many people do any of us know who got support with their mental health because of calling police, versus having caring people who could respond not just in the moment, but on an ongoing basis? $2.6 million for a pilot will do more for the community than all $395 million combined of the police budget, or even of the increase to the $405 million that the mayor is proposing. The community demands the opportunity to start a crisis response model that has zero police involvement and then grow it over the next few years. Really, the police in Boston have had 400 years to pilot their model, and it has failed to do any good. It has only helped to destroy people's lives and communities. Why continue to throw hundreds of millions of dollars to this destruction? We need hundreds of millions to go to mental health crisis response, to youth jobs, affordable housing, participatory budgeting, and everything else our communities actually need. Finally, we need to make sure that the city doesn't corrupt this model. Where this model came from was years of organizing, which reached a high point in 2020 during protests nationally and locally after George Floyd and Breonna Taylor were murdered by police. The city finally decided it had to do something, including looking at responding to crises without police. Community groups pressured the city to put money into funding this community-led design group, and it's that group of community residents who came up with this model. We need the city to continue honoring that community leadership by funding this model, including a community oversight board that approves the final program to make sure the city doesn't take it in a different direction that involves the police or institutionalizes people without their consent. Fund $2.6 million for the mental health crisis response community-led model now. Thank you.
Thank you, George. Just a pause there. We had scheduled for Dr. Bisola Jakutu to remain till 4. Unfortunately, fortunately, she's given us a little bit of extra time, and we appreciate it. Dr. Bisola, thank you so much for being here with us. We're staying, and obviously the administration is still here listening. This is being recorded. Tim is staying with us, and Council Lara, as I understand, is still with you. So we are listening, and will amplify your messages. Dr. Bisola, thank you so much for being here. Have a wonderful day. All right, let's continue with our testimonies. Who's next?
Next up is Thea.
Hello, my name is Thea. My pronouns are Zir. Some of my identities are I am a psych survivor, I'm a foster care survivor, a trauma survivor, an African descendant, a youth worker, a community organizer, and a freedom fighter. So, similar to bacteria, whether visible to others or not, there are social determinants that push folks towards mental, physical, and emotional unwellness, systems in place that push people to breaking points. Violence and oppression cannot be divorced from holistic wellness impacts and outcomes. These violent systems originated centuries ago and surfaced in the health impacts of those horrors to pay the price. Mental health crisis responders are vital to the humane treatment needed to repair this harm, reparations. Police are not doing mental health crisis response, they're causing mental health crisis by terrorizing people. Training folks who deal with these challenges to support in a way that folks in power who created the conditions for these crises can't do it. We're not accepting no. Remove $2.6 million for this pilot from the police overtime budget into this pilot to fund this model. That's my testimony. Thank you.
Can I just ask you about your crown, though? It looks like a phoenix on camera, but then is it a crown?
Oh.
Where is she?
Are you asking me a question?
They.
Yes.
Z.
Is that why it looks like a phoenix, but it's a crown, right?
Oh, so I'm wearing a t-shirt head wrap, and then I have like a little crown situation, and then I also have like a headband with flowers and a veil.
I love it. Thank you. Thank you.
Bye.
All right. Bye.
Yeah. All right. Next up, we have Betsy L.
Hi.
Hello, everyone. My name is Betty L. Burhane. I am a youth worker. I'm also a young adult, 24. I'm a student. I am an older sister to many people in my family. And I'm here to talk about, I'm here to ask y'all to start prioritizing safety and mental health of young people in Boston. Specifically, like, this is the time to do it. Like, I think having undergone a destabilizing times as a globe, like having gone through the pandemic, are still recovering and still undergoing the pandemic. I've just witnessed very close, I've witnessed a lot of young people who have just been very overwhelmed and have just been very like in need, both as like someone who is a youth worker and like close to my, like a family and a friend. I often don't have a place to call because those things, the things that like the top partners that I need, when I call like social workers at specific hospitals, they have long lines. When I've called like different initiatives, like there's just so many holes in the system. And I've like, for the past 3 months, I've unfortunately experienced directly like the failings of those systems. And like, I think because of the community that I have behind me, both who are in this room and who are not in this room, I've like been able to like support people. But I think about the people who don't have that. I think about people who would be supported with this model, who can call for free without worry about language barriers, without worry about financial barriers, without worry about, I think about young people who can call warm lines that this model would be able to offer. Like this community-based mental health crisis response model was designed and took like young people's needs into consideration. The young people I support, they went out and surveyed other young people and asked them, what do you want? And they asked for warm lines. They asked for someone to text. Every young person I talk to every day will always say like they want someone to check in with. And you don't do that with like the police. You can't do that with the EMT. You can do that with someone who is appropriately trained, someone who is part of your community, who can come to you if you need it, who can come to your school and be an advocate. And this is what the model will help, I think, like bridge and like close these holes that we have in the system. And
thank you, Bethu.
Thank you all. And I really hope that you all fund this model and then also just continue to fund other things that the community needs. Because we cannot continue to have a budget, we cannot continue to have a 405 million for the police while we have zero for the people who really need it. Thank you.
Thank you.
Next is Marina. Hey, Marina.
Hey y'all, my name is Marina Burhane. I am here today to share a testimony in support of fully funding a pilot that is, fully supporting a pilot that is community-based mental health crisis response model at 2.6 million. I am here as a member of the city school and as a Dorchester resident. I believe that it's critical that we prioritize mental health and invest in community-led solutions that do not involve the police. The current police mental health response is not only costly, but also poses a significant threat to individuals experiencing mental health crises. And as community members, we hear time and time again that there isn't enough funding available when it comes to the city's funding for community-based programming and resources. And on the other hand, we have law enforcement asking for additional funding and to the already like bloated budget that they have. And the city always manages to find a way to give them that money. And we see that such as the proposed $10 million increase for the 2024 budget for the BPD. We know that this is a falsehood, that there isn't enough funding available for the community-based mental health crisis response model, and we are only asking for a small fraction of the city's budget, 2.6 million. So please, if you care at all about our community or the community that's here, fund the pilot. Thank you.
Thank you, Marina.
Next we have Farah.
Hi, everybody.
Hi.
First thing, I just want to shout out this room. I think one of the things that's really powerful about being in this room that I just want to make sure to communicate is the clear dedication and determination of folks to insist and be really clear that we need this model. I think that's incredibly clear at this point, from people who haven't gotten to speak to people who have bravely stood up here and shared their testimony. My name is Tara Venkatraman, she, her pronouns. I'm a Roslindale resident, a youth worker at the city school, and a clinical social worker. I'm also a member of the steering committee that helped to develop an over 60-page detailed report for the city of Boston around what a community-based mental health crisis response could look like for our city right now. Our city is facing a heartbreaking and staggering mental health crisis. And yes, while exacerbated by the pandemic, we have to be extremely clear that mental health crises are also created by racism, anti-Black racism, and police violence. Both as a therapist and a youth worker, I talk with young adults and young people every day who describe their increased anxiety, depression, post-traumatic stress disorder, and major mental illness precisely because of racial violence. So it's not that the police are not the right force to respond to mental health crisis, it's that the police represent the exact problems that are leading to mental health crisis. While police are called in crisis, police are actually not the ones responding to mental health crisis right now. Community members are the ones responding. The folks in this room are the ones responding without resources, but responding all the time, doing the exact things that we talk about in detail in this model. There are friends who are available for each other 24/7, who will show up for each other late at night. There are family members getting family members safe, non-carceral transport to the hospital under the conditions of major mental health crisis. There are youth workers de-escalating conflict with young people they know and don't know. And there are community orgs providing spaces for safe syringe disposal. These are all things that are happening right now in this city. But we need more. We need a comprehensive resource that everyone in the city can access at all times. So we have an incredible opportunity in Boston right now for a solution that is both very grounded and very groundbreaking. It's grounded because community mental health responses are working all over the country, from Denver, Colorado to Oakland, where a few of us had the opportunity to learn in person how macro is working on the ground. It's also groundbreaking because our pilot model would create good jobs, put resources into the work that is already happening, and mean that our communities actually have someone to call instead of being left vulnerable in some of the worst and hardest moments of our lives. We urgently need $2.6 million to be cut from the law enforcement budget and moved into a pilot model of this community-based mental health crisis response this year. Thank you.
Thank you. We'll continue to hear our testimonies. Our hearing is scheduled to dismiss Tim as well at 4:30, just a heads up. But again, the administration is here, we're here, and this is being recorded for all counselors to review. Tim, thank you so much for being here with us, and look forward to reconvening if necessary in our working sessions.
Yeah, thank you, Council.
Thank you. All right, and who's next?
Hi, oh, that's me. Hi, my name's Teresa. Y'all already know why I'm here. I grew up in Boston. I currently work with the Asian American Resource Workshop as a youth worker, as a youth coordinator for Vietnamese youth and young adults in Dorchester. In the past 6 months alone, I've had 3 family members experiencing mental health issues as a result. They were institutionalized without consent, had unpleasant interactions with police, and are left with bills that we cannot afford. We need responses to mental health that are non-carceral, accessible, and meets our community needs. I'm here to demand that $2.6 million is divested from the police and funds a community-based mental health crisis response in the city of Boston. Thank you.
Thank you.
All right. Next we have Jazz.
Hello. My name is Jazz. I live in Dorchester, and to be honest, y'all need to cut $2.6 million from the police budget. I'm not trying to laugh because this is serious. Where was I? Clearly, we're going to use that money to create this pilot because clearly the police can't do their job, which is to protect us. So why not have people from our community take care of our community since we know what we need? Yes, people will be trained clearly. And plus, I think this is something all of our community can benefit from. There has been too many times where people are dying from the police. You're workers. Let me make that clear. You're workers. Well, I lost my train of thought. Hold on. I'm actually scared to call the police, if you want me to be real with you. I grew up with my brother being harassed by your workers. So, yeah. So I asked, how many people have to die from the police for y'all to understand the police officers are not trained for this? There are already other places like Denver, Portland, Oregon, Oakland, New York, Cambridge, Lynn, Mass that's already doing this. So why can't Boston? And that's my TED Talk.
Thank you.
All right. Next we have Teresa. Yeah, Teresa. You got this.
I'm Teresa. I go to VLA and I'm representing the city school. So I know and I have heard of a lot of individuals in my community who have had a violent encounter with the police concerning the mental health crisis. Most people of color are harmed or killed at the hand of the police during any kind of confrontation, but we still allocate billions and billions of dollars towards them. I've witnessed the effect of health disparities in my community firsthand. I've witnessed history repeating itself multiple times, and in terms of the harmful and ravaging effects that law enforcement has had and continues to have on my community. When the systems put in place to help in the advancement of a community have proven time and time again that they do not have any intention to aid in the well-being of Black and Brown communities, then is it really astonishing that members of the community who are significantly impacted have seeds of distrust and resentment planted in their heart. $2.6 million should be given to the mental health crisis response, a non-carceral consent and community-based model which is designed to help marginalized people dealing with mental health issues while replacing a violent and ineffective system. The mental health crisis response is going to have a positive and life-saving impact on the members of communities of color, including me, because we are receiving the help that was never provided for us in the first place. Thank you.
Thank you. Councilor Lara?
We have Marioma.
Is Councilor Lara still there?
I do not believe so.
Okay. Assalamu alaikum.
Alaikum assalam. Good evening, all. Good evening, all. My name is Mariama Farah. I'm 16 and currently reside in Roxbury. Like many others here today, I'm with the Youth Justice Power Union, and we are demanding $2.6 million be taken away from the police budget to fund a pilot model of community-led mental health crisis response. The current system relying on police to respond to mental health crises is quite frankly ineffective and often results in more violence and harm, especially to those in marginalized communities. We say it's time for a new approach that prioritizes compassion, care, and community-based solutions. And this model does just that by providing individuals in crisis appropriate care instead of treating them like criminals. Additionally, the model's inclusive approach ensures that everyone has a voice, allowing us to address the specific needs of each and every community. I urge decision makers to prioritize the mental health and well-being of our communities by approving the allocation. This would be a major step towards healing our society. Thank you for your time.
Thank you.
Next we have Miller. Yeah.
Hello, my name is Carmelo, and I have a story to tell. I went to Cambridge a little while ago, and I saw a very sad sight. It was a sea of people in mourning, angry that they lost someone very important to their communities, to the police. The crime he had committed was needing help during a mental health crisis. Instead of de-escalation or help, what he received was bullets. That sight is one I never want to see again. Police show up in our neighborhoods, not offering help, but pain to the people and harm. But pain and harm to the community. This is why I think we need to divest $2.6 million from the police and invest it into this new mental health pilot that is led by the community and is for the community. Thank you.
Thank you.
We have Naria. Naraya. Yeah, Naraya.
Hi, my name is Naraya Beckton. I'm from Jamaica Plain, Boston, Massachusetts, and I also have a story to tell. When I was a teenager, I had a mental health crisis, and my mom needed to help me, and she had called the cops. And
well, she dialed 911 and the police came. And I remember feeling fear in my heart because I thought that in seeing police in the media, I thought that, something would happen to her because they thought that she would be the aggressor. So I thought that she would be taken away either in handcuffs or in life. And I thought that I wouldn't be able to see her again. But thankfully, we both went home that night and we were able to live another day. And I'm thankful for that. But I just can't, I don't like the feeling of living today and just thinking that that could have happened when that actually did happen. Like the North Miami situation where the caregiver was shot because he was trying to take care of his autistic patient, and it shouldn't be that way. So that's why we are demanding the 2.6 million. Thank you.
Thank you. Thanks for sharing.
Right, and I think with that, we are concluding our list of public testimony. Yeah? Oh, yes, sorry. With that, we are concluding our list of public testimony.
Wow, thank you. I would clap for you. I'd like to thank you all for your bravery, for your vulnerability to be able to share your stories, all sentimental and heartfelt. This hearing, I assure you, will not be unheard or unseen. I will be distributing it in video to my colleagues, as well as sharing it with the public. I'm going to make public what you've asked for today. So the 2.6 million out of the police budget to the preventative and recovery program, diversionary program, and look forward to seeing you again. I'm going to be coordinating with George and others to ensure that we find a location, that it's in person. I'm going to make it up to you. We have to do this in person. We have to do it convenient. It's at your convenient location. So many amazing stories. You guys are young and strong, right? What did the guys from Tennessee said? Young and sick and tired. And I absolutely applaud you for coming here and to be able to voice your concerns, to advocate for others and for yourselves and your families. Absolutely. Your stories are 100% amazing. Thank you. And with that, this hearing is adjourned.